Hi everybody, my name is Karama and I'm here with my doula friend Natasha.
Hello.
Today I want to tell you a little bit about Dynamic Yoga Journey. Here I will teach you how to stretch appropriately, whether you're pregnant or not. If you just want to learn about the practice of yoga, I can assist you there as well. Balancing, strengthening, flexibility, calmness, focus of mind and breath and body. These are the things that I will help you with here at Dynamic Yoga Journey. And Natasha,
In addition to what Karama does with Dynamic Yoga Journey, one of the most important things I tell my clients is to relax the perineal area. A lot of times they're not sure what that means, so where Karama comes in would be a lot of hip stretches, a lot of stretching the pelvic area. So we go hand in hand.
yes, I cater to men and women for my practice, but when I work with Natasha, it'll be primarily for women who are pregnant.
Yes.
So join us here on the mat whenever you're ready, and thank you.
Hope to see you soon.
Bye.
Bye.
Hi everybody, I'm here with Natasha from Beloved Bellies, and I'm Karama with Dynamic Yoga Journey. Today, Natasha is going to give us some tips and tricks that will be very beneficial for pregnant women.
Good afternoon again. Thank you for joining us. We are here again to give you some tips on how to open up your perineal area. A lot of my clients usually ask, what can I do to help prepare for labor? And yoga and childbirth preparation goes hand in hand. So right now I'm going to show you a couple things that I encourage my clients to do, again, to open up the pelvic floor, to help kind of drop down this area so that you're not so clenched and tight. One of them is called a hip sway. So what you do, and this is during active labor or early labor, is again to open up the area and kind of relieve some of the pressure. So you're bending over, your head could be down, it could be up. This also can be done on all fours on a birth ball or exercise ball. And what you do is you're just swaying your hips. You want to open up as wide as you can. Again, you don't want to be too wide so you're uncomfortable, but just enough. And it's just a gentle sway. You're trying to stretch, again, all these ligaments, all your muscles. Relaxin is released during or labor, so that you kind of want those enzymes to kind of get where they need to go. So again, we're just swaying. Also, another thing would be squatting. A lot of times I encourage clients, you need to squat because you want to open this area as much as possible. And again, the yoga side of that comes in where you start doing stretches and even breathing and things of that nature to kind of help you get down here. If you're not flexible before you get pregnant, 9 times out of 10 you won't be flexible after. So a lot of this is preparation. So you want to get you an instructor, you want to start your practice so that you're preparing for. You don't want to wait till the last minute. A lot of times it will be painful. You know, you have a big belly in front of you. So a squatting position would just be that. All the way down. Our yoga instructor with Dynamic Yoga will show this to us a little better than what I'm doing. But again, it's just your pelvic floor, your vaginal area that you want to open up and learn to relax that so it's not so clenched. Again, through childbirth, you want to open up the area to encourage the baby to come down. When you're clenched, it holds everything up in place, just like tension. So what this does is, again, relaxes the perineal area, and Karama will give us a little more insight with that in a few. Thank you.
So in addition to what Natasha has said, there is something else that a pregnant woman can do to help stretch through the hips and strengthen the hip area. So, and I'll show you this. When I was pregnant, I did it all the time. I did it in bed, I did it on the floor, I did it morning, noon, and night. I would fall asleep in this position because I just wanted to be stronger and prepare myself for birth. So I'm going to show you happy baby pose. You'd lay on your back, draw the knees in, open the knees wide. Of course, the knees have to be wide because you want to make room for baby. So, knees are wide, and bring the feet into the air. Reach the arms up on the inside leg or on the outside leg, but it might be more comfortable on the inside. And then use the hands and pretend you're pulling the thighs toward the floor. And the foot bottoms should still remain in the air. And just a gentle pressure on the legs to help stretch and strengthen the area, making it more flexible. And this will help you as you do other exercises in the future to help the baby descend. How long should you hold this? As long as you're comfortable, but you want to do it as frequently as you can. So this is Happy Baby Pose.